Hello, everyone. Today we are going to look at the non-communicable disease section of the disease unit. First of all, we want to look at what are non-communicable diseases. A non-communicable disease is a disease that cannot be spread from person to person. For example, you cannot catch diabetes from someone who has this disease. Some non-communicable diseases are chronic. Chronic diseases are present either continuously on and off or over a long period of time. Asthma is a chronic disease. Another communicable diseases are considered degenerative. A degenerative disease is a disease that causes the breakdown of the body's cells, tissues, and organs as it progresses. Multiple sclerosis is an example of a degenerative disease. Some babies are born with physical or mental disabilities caused by birth defects or genetic disorders. The cause of birth defects are unknown. All disorders that are present when the baby is born are called congenital disorders. Examples of congenital disorders include cystic fibrosis, sickle cell anemia. These two diseases are caused by hereditary factors. Risk factors that contribute to developing non communicable diseases include lifestyle choices. Researchers have found that certain risk factors increase a person's chance of developing a disease. Heredity, age, gender, and ethnic groups are factors over which people have no control. People can, however, control one major group of risk factors: their lifestyle choices. When people make unhealthy choices, they increase the risk of diseases. Drinking too much alcohol, for example, can cause cirrhosis of the liver. Smoking tobacco can cause lung cancer and other respiratory diseases. Risk factors include eating healthy foods, in particular nutrient dense foods. So again, when you look at risk factors by doing these should help in terms of reducing the chance of you getting a non-communicable disease. Eating healthy, nutrient dense foods. Exercise. You should at least exercise 3 times a week for 60 minutes. Be aware of your weight. With that said, doing the first two things helps with this. Don't develop an eating disorder. So, again, if you eat the healthy foods and you exercise, don't necessarily worry about your weight. Sleep. You need at least 8 hours of good sleep. Manage your stress. Learn great time management skills. Avoid tobacco, alcohol, and other drugs. Manage your environment. Your environment is what you're exposing your body to. Like if you're in an area where there's a lot of smoke or pollution, try to avoid that if you can. The above mentioned is common theme of health. You've heard me mention these throughout the course, and you're probably going to hear me mention these a lot more. Again, this is the basis of what I do in my life to try to help deal with stressors and keeping me healthy. Want to turn our attention to cancer. A lot of times I refer to this as the big C. This is a terrible disease, and anybody that's known anyone that has had to go through this, the pain and suffering that they go through is tremendous. A cancer diagnosis can stir up fear of the loss of life, as well as a fear of changes to the quality of life. Cell division is normal, it's how the body grows and heals, but the cell division is highly regulated. The body sends signals to the cells to start dividing and another signal to stop. The body also has regulations to ensure cells don't divide on their own. The signals that trigger cell division are produced by genes. Genes that produce these signals to stop the cell division are called tumor suppressor genes. As cells divide, errors can occur. These are called mutations. As cells divide more quickly, more errors occur, thus leading to an increased chance of cancer. 6 factors that contribute to cancer. They're self sufficient with growth signals. This means they no longer need an outside source to signal their growth. They become their own doers. Okay? They basically take control. The switch to turn them off is ignored. This allows the cancer to keep growing. Cancer cells work with the immune system. This allows the cancer the cancer cells to avoid detection. It's kind of like working together, and the immune system doesn't recognize it. The more cancer divides, the more mutations occur. Mutated cells gain new functions, one which is extending their lifespan. In simple terms, this means they do not die. Just because cancer is a mutated cell, it still needs nutrients to grow and survive. Cancer forms new blood vessels to access the bloodstream. As cancer grows, it will metastasize. This means it will develop uh, to thrive in new location, other parts of the body. Two key terms you need to be aware of. First of all, benign. Cancer does not spread, and malignant spreads to other body parts. Some benign tumors start dividing uncontrollably but can't spread. Benign tumors could develop a mutation to allow them to be malignant, which means they would metastasize to other organs and sites. Four main types of cancer: carcinomas, the most common type of cancer, this cancer that develops in the lining of organs; sarcoma, cancer that is in the bones, muscles, and blood vessels; leukemia, cancer that forms in our blood, which comes from our bone marrow; lymphoma, cancer that forms in white blood cells. The warning signs of cancer: remember the word caution, change in bowel habits, loose stool or constipation, a sore that does not heal, unusual bleeding or discharge from the body, thickening or a lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in a wart or mole, nagging cough or hoarseness. Use the ABCD rule to diagnose skin and try to detect any skin cancer, in particular a mole or a birthmark. Look for asymmetry. One half doesn't quite match the other. Border irregularity. The edges are irregular, ragged, blurred, or notched. Color. The color over the mole is not the same. There are different shades of the colors throughout the mole. The diameter, the mole is larger than 6 millimeters, the size of a pencil eraser, and growing. Screening for cancer is the examination or testing of early signs of cancer, even though a person may have no symptoms. Medical screenings can result in early detection of about half of all new cancer cases each year. The current 5-year survival rate with early detection is about 80%. With regular screenings, the rate could increase to 95%. If cancer is a possibility, a biopsy may be performed. A biopsy is usually necessary to determine whether cancer is present. X rays and other imaging techniques help determine a tumor's location and size. Ways to treat cancer: surgery removes some or all the cancerous masses from the body. Radiation therapy aims rays of radioactive substances at cancerous cells. The radiation kills the cells and shrinks the cancer mass. Chemotherapy uses chemicals to destroy cancer cells. Immunotherapy activates a person's immune system to recognize specific cancers and destroy them. Hormone therapy involves using medicines that interfere with the production of hormones. These treatments kill cancer cells or slow their growth. On a final note, there are outside influences that can increase the risk of cell mutation and lead to a higher risk of cancer. These cancer causing influences are caused by carcinogens. Avoiding tobacco products, alcohol, asbestos, radon, UV lights, and processed meats to help control your risk of cancer. Also, avoid behaviors that would increase getting an STI because of some cancers have been leaked to viruses. Make sure to stay active and eat healthy diet to avoid the risk of cancer. With that being said, I hope you enjoyed the show.